It's my pleasure to welcome in this series I'm calling Reflections from Pharmacy Leaders Advancing the Profession, Dr. William Smith, who served as Director of Pharmacy at Memorial Hospital, Long Beach, California, and he was also a clinical professor at USC. He also served in roles at Virginia Commonwealth University as an associate dean and also academic roles and leadership roles at Northeastern University. He's recognized as an early pioneer in the development of clinical pharmacy, in particular with the ninth floor pharmacy project at UCSF, which was a really seminal development of satellite pharmacies. He's been recognized with the ASHP Harvey Whitney Lecture Award. So it's my pleasure to welcome Dr. Smith. So the first question, we would like to learn more about your journey in your career to your recognition as a leader. And in reflecting on that, you may wish to include key events that shaped your journey or key people that influence you in your journey.
Well, it all started at UC San Francisco. Actually, it started before that. I started working in a pharmacy in Southern California when I was a junior in high school. And after working there 4 months, I decided to go into pharmacy. And the owner of the pharmacy was a 1923 UCSF graduate, so he made it very clear that's where I was headed. So I went to UCSF and had to start working in my first semester in school, and I was working in a private small chain in San Francisco, which was a very, very busy pharmacy. And over 3 years, I got very dissatisfied with the pharmacy and I got involved with Dr. Donald Brody, who was the advisor to student council. And anyway, I ended up going to the residency with him and was even during the residency was turned off by the disconnect between what I got in my education when we were educating us to be drug consultants from what I saw in practice, even at UCSF. So I was looking to do something else and all of the job opportunities fell through. So I was at the hospital pharmacy as a summer vacation reliever and Eric Aoyang was the chief pharmacist. And I was asked if I wanted to be a part-time instructor as a clinical professor. And well, I got anything else to do, so why not? So the first course I taught was in cosmetology of all things. And a few weeks later, they came and asked me if I wanted to spend the other half of my time putting a pharmacy up on the 9th floor of the Moffitt Hospital. And I said, well, I've got anything else to do, so why not? And that's when it all started. And I was immediately confronted with the question, well, what are we going to do up there on the 9th floor? And that question, I still believe, is the critical question before the profession. In other words, what should the pharmacist be doing in community pharmacy, ambulatory care, critical care, and so forth? So the 9th floor started, and the rest of it is kind of history, and it was an incredible experience. And we made some major contributions to patient care drug issues within a couple of weeks. We were up on the floor.
Wonderful. And then you moved on to Memorial Hospital and set up a similar concept.
Dr. Brody was pushing me to get out of UC system because he said, there's no future here for you. And I said, well, that's kind of crazy. I was educated to become a pharmacy manager, and yet you're telling me I can't do that at my own institution. So I was hired in Long Beach as assistant director with the job to put through the whole decentralized pharmacy program. And the administrator at the time, Mr. Donald C. Carter, had written in March of 1960 the first article on the satellite pharmacy concept in Lilly's Tile and Tell. And so I was hired eventually to put the program together, and a year later I became the pharmacy director. And over 20 some years there, we really built a premier decentralized clinical program with pharmacists managing drug therapy as early as 1970, and a full-time kinetics consult service, full-time drug information service. And this was with a private medical staff. And everything was good until the late 80s, and then the administration changed and it all kind of got uncomfortable. So I left there and I decided to go visit my friend, Dr. Ken Barker at Auburn University, and got my PhD degree, which was an incredible experience.
Wonderful. Excellent. Great. So my next question, what do you think will be your legacy? And I often say in 20 years, reflecting on all the contributions you made to help advance the profession, what are you most proud of?
I think answering the question, what should pharmacists do? And we built a clinical program, and at Long Beach, we had visitors from over 30 countries. We had visitors from almost every state of the United States. And we proved that pharmacists could become involved in clinical practice with private physician support and nursing support. The thing that we didn't do, we didn't publish enough, and two, we didn't get any help from the universities out there in the mid-'80s to help us do some outcome measurements. But I think to answer your questions, I think it's building the idea that pharmacists could become involved in the clinical care of patients and be supported by medical staff, nursing staff, and administration.
Wonderful. Thank you very much for that. So what advice do you have for students as they develop in their professional journey, especially as they become leaders to help advance the profession?
Well, when I was teaching students both at Northeastern and at Virginia Commonwealth University, I had elective courses, and I had them try to write their ideal practice description. It was going to be in community pharmacy, acute care, whatever it was, because I think you have to be able to articulate what you think your practice ideas are, and in using words that are non-inflammatory to the other professions. That's the first thing. So it's a vision of what you think your practice should be, and I think it has to be individualized. And my experiences was the students really didn't like to do this. It was not something they found easy to do. Mm-hmm. And so that's the first thing. The second thing is I think they need to develop some abilities to measure the outcomes of what they're doing. That gets into research methodologies. My friend Max Ray says he didn't like the word research, so we called it scientific management of services. And I think that is a huge deficit in pharmacy education and even in residencies, where they can have some knowledge about acceptable methodologies. And my experience of being a graduate student with late Ken Barker, there's about 8 research methods that I think are applicable that you could apply depending on the question and practice. And I think they have to become committed to providing care to patients. And one of my close associates through the years, Jerry Briggs, who is the author of Drugs, Pregnancy, and Lactation, had a very simple methodology, and that is you look for drug problems and then you come up with a solution to solve them. And I think that that's something that students should be taught, how to look for drug problems in your area of practice, and then, okay, how are we going to solve this problem? So that's my simple suggestions out of several more, but we don't have time to cover them all.
Okay, well, thank you for that. So my final question, as this is embedded in a history course, as we have studied or are studying the evolution of the profession over the last 150 years, as we study the decades of the 2020s, one of the key events in that decade will be the COVID-19 pandemic. And as other events that have shaped our history, the COVID-19 will also shape our history, will probably be viewed as a key turning point in our profession, as an opportunity for the profession. So would you like to comment on how you see that shaping our history and creating an opportunity for us?
Well, from what I have read and what I have seen on ASHP Connect and so forth, certainly the drug therapy selections and accessibility and so forth is something that pharmacy has been confronted with. I think being a source of information to sort through all the mixed messages we're getting from whatever level of government you want to talk about is being an expert in really what is real and what is not real. I'm not a big fan of getting so excited about doing testing. I think pharmacy needs to focus its real mission, which is in drugs and drug therapy. But those are some opportunities that I have seen that we ought to consider doing.
Excellent. Very good. Well, Dr. Smith, I really appreciate your taking the time. It's always a pleasure. Thank you again for your time.
Well, thank you for the invite. And I have some suggestions for you that I'll send in an email of other people that you may consider if you haven't considered.
Thank you. I appreciate that.
Okay.
Thank you.